good afternoon, good evening, good morning, whatever time it may be in your part of the world. This is Woody Collins, and this is another day of talking about Congo. And I'm with Congo Helping Hands. We do humanitarian work in the Democratic Republic of the Congo. So we're just bringing you a taste of what we see going on in the Congo. And this week, it's kind of been also, we've been thinking about what is happening in India and also people in Africa thinking about what's happening in India. And the World Health Organizations is they are really thinking and hoping and 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 they got their antennas up trying to see whether Africa is going to follow the path of India. Now, India is the second most populous country in the world, and they look at uh, Africa being the second most populous continent in the world. So, but I think the second is where it ends. Because one of the things that you look at is number one is by being in India, I think they're most densely populated. And from that standpoint, that is where things went sideways. When you got a lot of people living together, that's where the disease can spread and overpower you. I mean, it's just sad that they ran out of oxygen. People, due to their burial practices, they're having to bury people right out of the hospital as they die in the streets and things like that because it's just overwhelmed their country and things. So, looking at that, people, and when I say people, the WHO, the World Health Organization in Africa, uh, is looking at that and saying, is that a possibility to happen in Africa? So let's look at that because what they've done is broken down and they've listed three countries that would be I guess, susceptible to a big increase in uh, the pandemic and potentially produce something like that. Number one, they look at South Africa. They have plotted the curves of what went on in South Africa, and with their second uh, wave, when South Africa went through it, it was very similar to what's going on in India. If you look at the curves and everything, they look almost like a mirror match. So they're thinking that South Africa could go through another period where they have extensive uh, um, infections with resulting deaths and hospitalizations. However, I look at, and this is my opinion, that South Africa is not as densely populated as India. And to me, that's one of the key factors that I'm looking for that's going to save Africa. Number two, the second country was Ghana. They're looking at Ghana as a potential uh, uh, country that uh, they've done well, and they're thinking that it is one of those countries that could reverse its trends and become a major uh, spreader of the pandemic. I don't know that much about Ghana, but I think they're doing pretty good. But the World Health Organization did redistribute the vaccines from Congo to Ghana. So there must be something that the World Health Organization saw that they wanted to prepare the Ghanaian country for and the Ghanaian leaders to try to take care of. And the third country was good old Congo. And you know, from what I've seen in the Congo, I don't think that's particularly popular. That it may happen. Potentially, uh, Kinshasa is the flashpoint. However, the Congolese government has really looked at Congo from the standpoint of controlling the entrance of people who potentially can bring in the disease. And just like last week, they put a apartment building under quarantine house arrest that was housing some Indian residents that they thought could potentially bring in that potentially had brought in the disease. Hadn't seen any more on that, but they're going to be locked down for 14 days. So we'll see how that works out. So I think the Congolese government, particularly in Kinshasa, they are really trying to stay close watch on what's going on and going to stamp it out as soon as possible. And then the other flashpoints in Congo is the eastern area in Goma and Bukavu, in those areas that borders the east, because the variant has been uh, detected in Uganda. So that's over in the east. So potentially, if that make it across the porous border that they have over there, uh, that could become a flashpoint. But whether that spreads to the rest of the country, I think is highly unlikely because uh, Congo doesn't have the transportation system, and the flights mostly out of that area is going into Kinshasa, and so hopefully that Kinshasa would be the second point, and they would be able to lock it down. And Congo, you know, is a verily, even though it has 90 million people, 89, 86 million, whatever the case may be, it's a very large country, and you have areas in uh, the major towns. However, beyond that, you have open areas, and a lot because it's a poor country, people work outside. People, it's not an industrialized company where thousands of people work in a factory environment and things like that. So I think that yes, it should be looked at. The World Health Organization should, keep watch on things. However, especially in the case of Congo, I don't think that it will, materialize. But Congo is also one of the weaker countries that has no basic health infrastructure. So if anything does start there, it will be like uh, an open field being burned that there's nothing to stop it from burning and burning and burning. But we'll have to see. I've been wrong in my predictions about Congo in the past, and they've shown me. And I hope that I'm right this time because I'm on the side of the Congolese, and I'm thinking that they're going to beat it. So I hope my losing streak doesn't keep going, meaning to say everything that I predict comes out wrong because I'm predicting that they're not going to be the next India. And so I'm hope that I am right this time and not wrong as I've been in past in some of my predictions about what was the pandemic going to do in Congo. So that's what's on the agenda. Thank you very much for stopping by. If you have any comments, please drop them in the chat area below. I appreciate you stopping by and taking a look at it. This is something that we're going to continue to watch and look at. And as always, let's get this pandemic under control. Number one, let's wash our hands as frequently as possible. Number two, wear our masks. And number three is socially distance ourselves. And lastly, when the vaccine is available to you, please get the vaccine so that we can develop a herd immunity. Thank you very much, and we will talk with you tomorrow. Take care, and we will see you then.